Alright, so my goal is to kind of demystify HIPEC a little bit and explain what it is and what it isn't. If I could advance the slide. I have no disclosures. So again, the goal of talks is to talk about what is HIPEC, kind of define it, why we do HIPEC, how we do it, what's the safety of HIPEC, and then what are the outcomes of HIPEC. So HIPEC stands for hyperthermic intraperitoneal chemotherapy. This is just the regional administration of chemotherapy within the peritoneal cavity. Hyperthermia, our goal is about 42.5 degrees Celsius, which is about 108 degrees Fahrenheit. So I often just tell patients it's a kind of a hot tub. It's an intraoperative given at the time of surgery under general anesthesia in order to attain that kind of hyperthermia. And it's a single drug exposure during surgery, usually for anywhere from some protocols as short as 30 minutes, some protocols as long as 120 minutes. But it's a single shot, kind of short drug exposure. HIPEC is another acronym for early postoperative intraperitoneal chemotherapy. This is given through a peritoneal like dialysis access port, or some people use peritoneal dialysis catheters, tank-off catheters. And basically this is regional perfusion after surgery, but no longer in the operating room. So now you can't obtain hyperthermia, so it's under normothermia. You have adhesions now that you have to deal with. But you can do multiple administrations and multiple dwells, and you can dwell much, much longer. So now you can use antimetabolites and some other slower acting chemotherapy agents. Neoadjuvant intraperitoneal chemotherapy, or NIPS, is often given the same way, through the same peritoneal dialysis port, but given before surgery as a neoadjuvant way to try to reduce the burden of peritoneal disease. And then HIPEC is pressurized intraperitoneal aerosolized chemotherapy. And this is basically when you're doing laparoscopy, you have pneumoperitoneum, now we're aerosolizing chemotherapy into the abdomen. Theoretically, there's a higher local drug bioavailability and a better therapeutic index. These are repeatable and largely used only in Europe and used in Asia, and used as kind of a palliative option for patients with unresectable peritoneal carcinomatosis, and given in multiple treatments, just as you would systemic chemotherapy. So why do we do HIPEC? Well, there's a certain kind of group of cancers we often term peritoneal surface malignancies, and basically they include ovarian, appendiceal, colorectal, mesothelioma, and gastric cancer. And basically what they have in common is these cancers have a high frequency of peritoneal metastasis, kind of a relatively low frequency of extra-abdominal metastasis. Some of these, especially the appendiceal tumors, tend to be very superficial, and mesothelioma tend to be very superficial into just the peritoneal lining. And so